Okay, we will start from the beginning. We're going to do just a quick rundown of each class, and I'm not going to get too much into detail. I'm going to get through all of them, and then we'll go back and go into a little bit more detail. All right, so let's start it out. Beta-lactam antibiotics. The examples of this class will be your penicillins. That includes penicillin G, penicillin V, amoxicillin, ampicillin, nafcillin, oxacillin, piperacillin, and ticarcillin. That would also include your cephalosporins from first generation to fifth generation. First generation is going to be your cefalexin, cephalexin. Second generation is going to be your cefuroxime, cephalacor, cefoxitin. Excuse me. Third generation is ceftriaxone, ceftazidime, cefotaxime. Fourth generation is going to be cefepime. Fifth generation, ceftaroline, which, but don't dismiss that often. Hey, whatever, words are hard. Next, you will have your carbapenems, which will include imipenem, meropenem, ertrapenem, and doripenem. Also, your beta lactams will end out with your monobactams, which is your aztreonam. All right. The indications for your beta lactams are going to be used for everything from it's a wide spectrum, broad spectrum, pneumonia, UTIs, skin infections, meningitis, and sepsis. Mechanism of action is going to be inhibit cell wall synthesis by binding to the penicillin binding proteins PBPs, leading to bacterial lysis. In other words, without that cell wall to keep everything in a stasis, you're going to have hypertonicity develop outside of the wall, or once the wall is breached, sucking everything out, killing the bacteria. Everybody's happy. Let's see, side effects. Naturally, anytime there's an allergy to that particular class, it's going to be a problem. But you also possibly could have a diarrhea or a C. diff infection. Also, this class of antibiotic is cleared by the kidney, so you do have to worry about nephrotoxicity. All right. Contraindications, naturally allergy to beta lactams. Also, you have to do some renal adjustment, as mentioned before. All right. Second on the list, the non-beta lactams. That's going to be glycopeptides. That's going to be your big gun, vancomycin, and also teicoplanin, and also phosphomycin. Teicoplanin, teicoplanin. In case my southern drawl doesn't get this thing right. So once again, that's a glycopeptides, which include vancomycin and teicoplanin, and also phosphomycin. Indications, like I said before, big gun, MRSA, methicillin-resistant Staph aureus, also gram-positive infections, C. diff, colitis, and also in the case of UTIs, we have the phosphomycin. All right, mechanism of action. It is going to inhibit peptoglycan synthesis in the cell wall, leading to cell death. All right, so it's going to also inhibit the growth of the cell wall, but just a different mechanism. All right, once again, you do have side effects of nephrotoxicity. Also can lead to ototoxicity. And in the case of vancomycin, you may end up seeing red man syndrome. So that's something that kind of sets it apart, make it a little different. Contraindications, you're definitely going to have to adjust renally if need be, and naturally if there's any kind of hypersensitivity to the class. All right. Third on the list is protein synthesis inhibitors. We're going to have your aminoglycosides. The aminoglycosides are going to be your gentamicin, tropomycin, amikacin, and streptomycin. Your macrolides, you're going to see these a lot of zithromycin, which is your Z-Pack, clarithromycin, Viaxin, and also erythromycin, oldie goodie. We have your tetracyclines. You're going to have your doxycycline, minocycline, and tetracycline. Hard to figure that one out. Your lincosamides, that's going to be your clindamycin. Also, your oxazolidines. Huh. Yeah, linazolid. So, yeah, that part. Let's see, indicator is going to be broad spectrum. So it's going to be both your gram-positive and gram-negative infections, and also your atypicals. So that's your mycoplasma, chlamydia, and rickettsia. Your mechanism of action. This is going to actually be binding to the bacterial ribosome. So that's going to inhibit protein synthesis. That's going to be the 30S or the 50S subunit. So basically, that's going to be more along the lines of protein replication. All right. All right. So side effects: aminoglycosides, common theme, nephrotoxicity, autotoxicity. Also, for macrolides, you have to worry about for your GI upset and QT prolongation. Especially, you're always going to see QT prolongation with a Z-Pack and something. Tetracyclines, photosensitivity, and also possibly have those dirty little stained teeth if the dose is in the adolescents, especially in adolescents. Clindamycin, you're going to have your C. diff, colitis risk. Linazolid, is going to be bone marrow suppression, also serotonin syndrome risk. Contraindications for aminoglycosides are going to be your renal failure, because it has to be cleared by the kidney. If your beans aren't working, you're not going to be able to use it. Macrolides, if there's a history of QT prolongation, or in general, I'd be a little nervous if there's any history of arrhythmia. Tetracyclines, if there's pregnancy, patient is pregnant, or if the child's under 8 years old, you want to stay away from tetracyclines. Linazolid, concurrent MAOI use, which honestly, I haven't seen an MAOI in decades, but if for whatever reason, maybe they're international and they're using some type of MAOI, you're going to have to watch out for that. All right, next on the list is going to be your, sulfonamides. That's going to be basically your Bactrim, your sulfamethoxazole trimethoprim. Indications of the sulfonamides are going to be primarily UTIs. That, or if you see pneumocystis, pneumonia, MRSA skin infections, MRSA skin infections. Your mechanism of action is going to be inhibiting folic acid synthesis, which is basically you have to have folic acid synthesis for the DNA replication of your bacteria. The biggie would be the Stevens-Johnson syndrome. So if there's any kind of red rash, then it develops after the initiation of therapy. That's going to be a definite stop. Don't collect $200 or a passcode. Also, hyperkalemia can cause high levels of potassium, and also bone marrow suppression. Contraindications, naturally, if there's any kind of allergy to sulfur. Let's see, also G6PD deficiency. They can run the risk of hemolysis, and also in pregnancy, especially near term. during the latter part. Next, you're going to have your urinary tract antibiotics. That's going to be your nitrofurantoin, your fosfomycin, um, indicated in pretty much UTIs caused by E. coli or enterococcus, uncomplicated UTI. That's going to be a mechanism of action for the nitrofurantoin. That one is actually going to disrupt ribosomal function. Phosphomycin is going to actually work by inhibiting bacterial cell wall synthesis. Common side effects going to be your GI upset. Also, long-term nitrofurantoin. I haven't really seen too many people be on long-term unless they've had some kind of issue with recurrent UTIs. But pulmonary fibrosis is possible. Long-term use of nitrofurantoin. Contraindications, pretty much renal failure, anytime that the creatinine clearance is less than 30. Also, pregnancy near term. Okay. Next in line would be the fluoroquinolones. Fluoroquinolones, most popular is going to be your ciprofloxacin, levofloxacin, also moxifloxacin. Usually indicated in UTIs, pneumonia, or GI infections. Also, osteomyelitis. Mechanism of action is going to be inhibit DNA gyrase and topoisomerase. All right, 4. Preventing bacterial DNA replication. All right. Side effects is going to be tendon rupture, possible QT prolongation, and also CNS effects. The CNS effects especially occur in the elderly population. They can have some very, very disturbing episodes, anywhere from not remembering where they were or just acting totally out of character. Let's see. Contraindications, pregnancy, and also if the patient has myasthenia gravis, it can exacerbate that condition. Next on the list, antiprotozoals. That's going to be your metronidazole and tenodazole, indicated for anaerobic bacterial infections. So that's going to be your Clostridiales difficile infection, your Giardia, Trichomonas, and amoebiasis. Mechanism of action is going to be produces reactive radicals, and that's going to damage the bacterial protozoal DNA. So it's going to be work by way of interfering with the DNA. All right. Side effects is going to be a metallic taste. Also, disulfiram-like reaction with alcohol. Basically, you get a hangover that just won't quit. Also, possible peripheral neuropathy. All right. Contraindicated, naturally, anyone who has used alcohol within 72 hours. Also, the first trimester of pregnancy, those would not be recommended. Okay. All right, I'll stop there and take it from the top and go a little bit more in depth.